Hello, class. My name is David Perez Vargas. I go to Northwest Vista College, and I am a psychology major currently taking abnormal psychology. Today, I will be talking about lying, the different types of lies, as well as what treatment is offered to those with compulsive and pathological lying, and how lying is connected to childhood trauma and early childhood events. I was honored to be able to speak with Lauren, who is an inpatient clinician therapist at Clarity, and I was able to ask her a few questions about how she deals with her patients and how she's able to help those who suffered a crisis, as well as how she has to deal with maybe patients who are not completely truthful. First of all, what is lying? Lying is the action of making a false statement, used with the purpose of deceiving someone. In society, people categorize lies as white lies, gray lies, black lies, and blue lies. White lies refer to lies that are viewed as harmless, usually to avoid hurting somebody's feelings. An example of this would be using an excuse to leave a party or not attend a social event. On the other hand, black lies refer to lies that are used to deliberately misrepresent the facts in order to deceive or gain a benefit that otherwise would not be possible. Lying is usually a defense mechanism, as sometimes people lie to protect the liar from being punished or to protect someone else from punishment. The lie might be to avoid being embarrassed, to hide an awkward situation, or to simply have others think better of the person telling it. Compulsive lying and pathological lying. It is important to understand that there are two categories for people with a tendency to lie. There are people who suffer from compulsive lying and others who are pathological liars. As stated by Karthik Kumar, a pathological liar lies insistently to get their way and does so with little awareness, while compulsive liars are those who lie out of habit. What are the differences? As stated before, pathological liars lie constantly. However, unlike those who are compulsive, pathological people lie with a purpose. They lie to gain something, to exaggerate things, and they keep changing on their stories. These types of liars do not care for others' emotions or rights and are usually manipulative. Pathological lying is often associated with those who suffer from antisocial personality disorder and narcissistic personality disorder. On the other hand, people who suffer from compulsive disorder usually lie without a clear benefit. It has been observed that people with attention deficit hyperactive disorder, ADHD, bipolar disorder, and borderline personality disorder result to lying compulsively. And unlike pathological liars, who tend to deny any allegations of wrongdoing even when proven false, compulsive liars are way less likely to try and hold on to the lie when confronted, usually coming to terms with the fact that they lied, though this might not stop them from continuing lying in the future. Trauma and lies. There has been found a similar link between those who suffer from personality disorders and have had some kind of childhood trauma or early childhood events that have led to trauma. So it is not unordinary that researchers have found a positive risk between people who suffer from compulsive and pathological lying that have also suffered from some kind of abuse as children, grew up in a family in which there was substance abuse, or lived in constant fear as a child, and lying developed as a form of self-protection. Many of whom later in life have an increased risk of lying to garner admiration, avoid a punishment, or entertain others, among many other reasons. Are there any effective treatments? Thankfully, there are several treatments to help suppress these lying behaviors. Treatments are counseling, cognitive behavioral therapy, and family support. Counseling sessions will diagnose any possible underlying disorders as well as recommending to attend couples therapy, family therapy, or group therapy. Cognitive behavioral therapy, a type of psychotherapy that will help a person become more aware of negative thoughts and learn to identify and cope with them. And it is important always to keep in mind that to have a successful therapy and lasting change, those in therapy must be self-aware that they suffer from said condition.
Okay, so I am a clinician there at Clarity for Inpatient. So I work with acute care kiddos. So they come in for about 3 to 5 days.
Mm-hmm.
So it's kind of fast paced. Sometimes we have only about 1 to 2 sessions while they're there. And then we'll have at least one family session creating a safety plan so the kiddo can get back into the community, school, home life. Where I went to school, I studied at Our Lady of the Lake University.
Yeah.
I went there for my undergrad and graduate. I studied in the marriage and family therapy program, but I have my LPC. I actually worked there about 6 years ago, but I do what Kristen does, what Kristen does now. I was a mental health counselor, but then I worked there for about 8 months, and then I had to finish grad school and all that fun stuff. And I came back as a therapist, and I've been there for almost a year now.
Wow. Okay. And how do you like it at Clarity?
I love it. It is very fast paced, but I really love my boss. I love all the people I work with. I love the sessions a lot, even sometimes they can kind of go south, but I just love all of it. So to be honest with you, I don't read the initial assessments. If I do, I just skim over it before meeting with them. Because I don't want to have I guess assumptions or judgments or kind of think a certain way because somebody else interviewed them already in admissions. I'll kind of skim over it if I need to, but I kind of come with like a softer approach. I've been told that I'm pretty approachable and I'm easygoing and they feel comfortable with me. But I just start off like, tell me about your home life, school, how's that going for you, how they take care of themselves, so what they like to do for fun. And then I kind of get into it like, since you're here, it might not be where you want to be, but what do you think we can help you with while you're here? What goals do you have yourself while you're here in the hospital or even once you get out? And then I ask them what brings them here. And by that time, they're pretty willing and open to sharing. I do have some that won't talk. I think I had one girl that would not talk, but she would write it out instead. And so I think allowing her, she eventually started talking. And so that was really nice. But also too, and then I'll go and read the initial assessment, and sometimes it kind of lines up to what they were saying, and then some of it I'm like, that didn't come up. But then it can come up in our next session or with the family session.
All right. Well, so there is a clear connection that it's more about letting the patient warm up to you, go in without a prejudice for what they might say, and being like, practically be willing to understand their point of view and what they are going through.
I found it helpful to sometimes talk to the parent one-on-one, maybe before our family session. And of course not divulge, everything the kiddo said, but kind of get them to understand that, like, their perspective and how it affected them, whatever it may be. And because I don't know what it is about a third party sometimes, like when parents are like, I've told them, to do this 10 times and they never listen. But then when they talk to you, now they're, they have a different perspective on it. I have a girl recently who is self-harming, and he goes, "What did you tell my dad?" And I'm like, "What do you mean?" And she was like, "He's so understanding now." He gets it and he listens to me now. And I'm like, I just talk to him, regularly, like what I planned to, what we talked about. And also too, it helps the patients when I explain my role in their treatment. and how I'm working with them, not against them.
Mm-hmm.
And I'm them talk about anything they don't want to, simply because it is fast paced. But it's good to get all that out so we can build a foundation, and it's stronger when you do that.
All right. Yeah, that's part of it. What's it called? Practically several steps of the therapy that I've been able to listen from what Kristen has told me is that a lot of it just depends on what the kid or patient has to come to trust and understanding with the therapist. Is like, hey, I'm not here to get you into more trouble. I'm not here to make your life like hell. I'm here to help you out so you're able to deal with everything that's happening. I know that there's many situations that the kid simply doesn't want to be there. And of course, it is understandable. They've been removed from what they even consider normal. But sometimes I see also that that's necessary for them.
Yes, to have that break.